This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a renowned dental author, lecturer, and expert on laser dentistry. He is a graduate from the University of the Pacific School of Dentistry and a sought-out consultant for dental manufacturers across the country, practicing from San Luis Obispo, California. Please welcome Dr. Michael Colleran, DDS. How's it going, Dr. Colleran?
Hey, it's going great. How are you?
I'm doing great, man. Good to talk to you again. Thank you for coming on the podcast. Once again, you're only the second person that is doubled up, man. Dr. Kanka was the other one, and Dr. Colleran is the next one, baby.
that is some really nice company to be in there. That's for sure.
Yeah. It was by popular demand. They're saying, Colleran, we want him back on.
Absolutely. We need a nap.
That's so cool, dude. Well, thank you so much. And so, I always like to start off talking a little bit about sports, man. I was just watching at lunch. I was eating my burnt ends over at Lucille's Barbecue at France. Went up 1-0 against, I think, Belgium. They're playing, man, and kind of crazy.
Wow. So it's like World War III now. France and Belgium are going at it again.
Exactly.
Wow.
Then I think London's playing someone else, Finland, or I'm not sure. Not Finland.
Ooh,
but
all right.
Who is it? Belgium. No, is it Belgium and France or? No, I don't know, dude.
I don't know.
All I know is France, man. We don't want them to win. No.
Yeah, exactly. They give up on everything.
Exactly. Yeah. And what are they famous for? The French fries? Oui.
Exactly. And French toast. I love that French toast.
Oh, so do I, dude. Give me some of that and some eggs and wafels. We'd be good to go.
My knowledge of World Cup is very, very limited. I haven't followed this one at all. In fact, the last one, it was quite embarrassing. I was out to lunch with my wife and my son, and we were in a sports grill, and they had TVs, all over the place, and about half of them were up for this match between Germany and somebody else.
Yeah.
And my wife's looking up there. It's like, oh, well, who's playing? I don't know. I don't follow soccer. What are you kidding? And she's like, well, why not? You like all the other sports. It's like, well, everything is always 1-0, or never score, nothing ever happens, And as we're sitting there during lunch, the score jumps from 1-0 to 3-0. And then it's 5-0. And I think it ended up being like 10 or 12 to 1 or 2 or something like that. And it's like, well, they're scoring plenty. What?
Yeah, that's good.
That's not the way it normally is. That's not the way it is.
That's
and it was like, well,
I know. I watch this game boring, man. It's like 90 minutes, and then they add on minutes for all the penalties. I'm like, what the heck? How come
exactly.
Man, we have an hour and a half here, dude. And this is boring as heck, but it's kind of, I don't know.
And then they end up in a shootout at the end.
Yeah, in a shootout, and it's like you got to.
They did all that time, and they couldn't score, and now they're going to take that from this. Everybody stand in a line and shoot. It's like,
I know.
Anyway,
and I get tired watching those little guys run around that field. It's tough, man. That's a lot of running around just for that.
A lot of running.
I like the Bend It by Beckman, the way they kick that ball, and it's like a screwball, or a curveball. It just curves around the guys and hits the corner. That's some talent doing that. But I remember
they have skills.
Yeah, I remember growing up the Pele dude. Remember that Pele guy? And he would jump up the air and go backwards, kick it, and land on his back. But that was some amazing stuff back then, man.
He was really amazing. That was the one guy that if soccer was becoming popular in America, it was because of him, because of the
showmanship.
He was amazing.
He was just.
Oh, he was fantastic.
Yeah. That was cool. I think he's the one that said football been very good to me, or no, maybe that was a different dude.
I thought it was baseball is very, very good to me.
Yeah, that's it. Like, who was that? That was
that was Saturday Night Live.
Yeah. Pepsi.
Right.
Hey, so what do you
Garrett Morris?
What do you think about LeBron James coming out to the Lakers, babe? You're gonna have to come down from the beach up north and come on down.
Well, we're going to leave the rest of the country out of basketball. It's just going to be San Francisco versus LA. Because now that
Golden State, baby.
Golden State signed that
DeMarcus Cousins. Can you believe that?
Yeah,
how the hell they get that guy? You know, they already got the most dominant team in the league.
Yeah,
exactly. And they add another guy with 25 points a game average. And it's like, dude, how the heck did that happen? That's so nuts.
Yeah, it'll be interesting what the Lakers do to support LeBron in bringing in other people this off season.
Yeah, I'm excited. We'll see, man. I mean, we got some good young guys, but I don't know. We need another, Kawhi Leonard or some other stud to help us. Right. I don't think it's going to happen.
Scottie Pippen or
Yeah, we need some dude that's draining threes out there all game, like some skinny little kid. Doesn't matter as long as you can make that three ball and get it in there. But what a trip, dude. And it's like I heard Carmelo Anthony, he might be going to the Houston Rockets. That might be a pretty huge thing with Chris Paul and Harden, and then to get Carmelo. I don't know. I never really liked him that much, but the dude, he's a 25, 26 point game guy, so he's still got a little bit, but I don't know. It's kind of exciting for basketball. I can't wait for it to start, especially now. Lakers. I'm such a Laker fan, been going there for years. In the last 5 years, dude, I kind of stopped because I didn't want to see Kobe all jacked up towards the end of his career. And then it was just the most boring basketball. But the last year or two with a lot of these young kids, it's pretty exciting, but still they only won like 30 games, man. But now with LeBron, man, the King James, it's going to be a different thing. And shit, the tickets went up double. Like, I mean, your usual $1,000 seat behind the bench is now $2,000 for a game against the Denver Nuggets, whatever, like no team. It's so expensive, but I can remember in dental school
the Warriors tickets. Gosh, I'm trying to. Who was the guy that beat up the coach there?
Latrell Sprewell. That guy, thug, man.
I mean, you could get tickets for the games, within 5 minutes of the game, probably pretty much the whole season, and they were really, really cheap. And it was a non-issue in San Francisco. Nobody knew who the football or the basketball team was at all. And now it's like everybody's got the shirts on and everything. It's like, come on.
Yeah. It's like front runners. I mean, they do it everywhere. We get on the bandwagon, it's like if your favorite's lost in Cinderella story, it's like, but what a great story though, from really nothing. And, the Splash Brothers, with, Curry and Klay Thompson's a local product around here, man. We used to see that guy in the pizza parlor, and his dad's, around here. And heck, he has a place right in Dana Point, right by me. And but he's a stud. With Rancho Santa Margarita, my operations manager. He went to school with them, and it's like, what the heck? Look at this guy. And it's just like now he's gonna get like a $200 million contract next year, man. It's like kind of crazy. That's nuts. All right, enough sports. Let's dental up. So, hey, man, tell me a little bit. I know you went Cal Poly for your undergraduate, San Luis Obispo, and you went to the Pacific School of Dentistry in San Francisco. Tell me a little bit about your college journey. What was it? Good? Was it bad? Any instructors stick out? Tell me a little bit about your journey there with your education.
Here at Cal Poly?
Yeah, at Cal Poly. Actually, first tell me real quick, why did you get into dentistry, and at what point do you think I want to be a dentist? What was that all about? Was that like in elementary school when your teeth were all every which way and you looked like Dracula? And you said, I want to go. Tell me why you got into dentistry.
Yeah, it was a momentary lapse of reason, that's for sure. There isn't any one specific thing that I remember. I remember in elementary school, out on the playground. And I think it was later that week I had a dentist appointment. And I think I was waiting my turn to get up and kickball or something like that, and sitting there and thinking, you know what, out there, that dentist is out there. He's out there filling teeth. That'd be a really cool thing to do. And that's the last I remember of that. I mean, it was just one of those fleeting things, but it's something that I recall. And then I was, 23, 24, and was looking for a reason to get back into school. It was like, well, what should I do? Should I be, get an MBA like everybody at the time in the 80s?
Yeah.
MBAs were, the fantastic thing to get.
Yep.
And I thought, well, that's kind of the easy way out, the wimpy way out. You sit in an office and do that kind of stuff. That doesn't sound good. I want to interact, with lots of people. And we got something in the mail, I think, or something like that. And it talked about how there was going to be this shortage of dentists coming up. And I thought, that sounds pretty interesting. I wonder what it'd take to get through. So I started looking into it, and that was the start of it. And I got back into school, and all the way through, it was like, I am going to dental school. I don't care what else comes along. I'm going. And I set my sights and got through UOP in 3 years, and here I am.
Now, was it real hard for you? I mean, with the math science, you must have been a smart little book kind of kid to be able to just say, hey, a lot of us couldn't do that. Hey, I want to be a dentist, but I can't put 2 and 3 together. And, no.
Exactly. Well, that's 5. But no, it was something that school was easier for me. I still have ADD, to this day. I can't sit down and just read through a book. I'm thinking about 50 other things besides what's on the page. But if I can concentrate on a short article or something like that, then that's me. As long as the instructors would lecture to their test, so that all I have to do is study my notes.
Okay.
And that would be on the test, then I'd be great. If they made you read the book to get a certain percentage of the questions on the test, then I was out of luck. It was bad.
That was my problem. I'd read a book, but I didn't comprehend anything. I'd forget about it once I read it, and it's because you weren't really
exactly.
was.
Yeah. I mean, the memory that I have for recalling stuff, or used to have. I can't remember my name now, but what I used to have in college and recall and stuff like that, that was the easiest thing in the world. So that was the one thing that I was blessed with that got me through it all.
So tell me, when you got out of dental school, did you start your own practice, you associate? Tell me about that. I
did a little of both. I purchased a practice about 6 months out. The guy was working about 2.5 days a week. He'd take like 2 months off a year. And so it really wasn't a practice that could support me, but it was one that I was starting up, and I thought, I can build this up and get it up to something that's doing really well. And I took the practice, and I almost doubled it in the 3 years I was there.
Yeah.
But the rest of the time I was working for a guy as an associate 2 days a week, and I'd work my practice 2 days, and then I'd do like a half day, maybe once a month on bigger cases. So the guy that I was with as an associate, he was older and he's looking to retire. And it's like, hey, do you want to buy this place? And, and I was like, well, I got my own practice, but, so we looked into things.
Man. No.
So we looked into it, and it was like, it'll work. I just need to basically sell my practice for the loans that I've got into it. And I was able to find a buyer. That all worked out. So I started working full time for him, and we start working on the details, and the details didn't work out for him mostly.
Yeah.
Well, he had a loan that he had to pay off if he did a pay down, it would have to be the whole thing all at once, including all the interest.
Okay.
And he was like, can't really afford that, with taxes and everything on it. It's, I can't sell you the practice. And it's like,
damn, I already sold mine. I got no job.
What am I going to do? And that's when I started looking around, and my wife's like, we could go back down to San Luis, and that was fun there, and got a lot of friends, and, nice area. And we got, Diablo Canyon there is,
absolutely
flourishing. And so we started looking down here, and sure enough, there's a practice. And it was a guy who went to school with the guy I was associating with. They were in the same class at UOP.
Okay.
And it all worked out, came back down here, and now they've announced that they're shutting down Diablo Canyon.
Well, that's good, man. They shut down San Onofre nuclear power plant right by my house, and thank you, Lord, man, because that thing it's a scary thing. It started leaking, We're like, oh,
exactly,
3 miles from the house, we'll be okay, right?
We'll just glow in the dark. It's all right.
Exactly.
You don't need lights anymore.
I take my boat down there. We call them the domes. They got these 2 big domes, and we go out in front of the domes. They got the best fish right there because the water comes out of there. And they got 2 heads and all sorts of weird things. But
they come out in their boat. They're talking.
They're talking to me like Mr. Lippet. Remember that movie, Mr. Lippet, with the Don Knotts? Yeah, that dolphin or whatever it was. Oh, that's crazy. It's real. That's how I ended up. That's a true story I heard, right?
Yeah, right there, Dana Point, San Onofre,
that's cool. So you went into San Luis Obispo, and what happened there? Did you buy a practice? Tell me about that.
Bought the practice. It has been 17 years that I've been here. So
good job, baby.
Put down some roots, and we're actually this year we're having the best year that we've had ever.
Thank you. And you are, and we are too. And it's amazing. I don't know if it's a Trump effect
we're sending
or
you
what.
Lots of crowns, that's for sure.
Yeah, you are, man. I love it. It's like, look at Colleran, man. He's cranking it. And a lot of my other guys are too. It's just, it's been a great year so far. What are we, 6 months in? And man, look at it. It's just, all the practices, man, all my practices are kind of pretty much up. And, we had records in March, and we had records in May, all-time sales records for the month, and we're almost going on 17 years too, 2002 since we've been here, but 16 plus, but or 16.
Yeah, I can't do my mouth. We have had 5 months over 100,000, which we've never put together before.
That's sweet.
For this month, we'll definitely be up and over that for this month. So,
that's so right cool. Along. Right on, Colleran. That's so, I love hearing that, man. And you practice great dentistry. I mean, you really do. And you've been doing it a long time. And, a lot of people don't know, man, you're like 7 foot, 300 pounds. You're like the biggest dude I know. How tall are you?
I used to be 7 foot. All this silver mercury, in the air and everything. I'm down to 6'5". So
6'5". Well, 6'5",
250.
Yeah. Well, I'm 255, and I'm like 5'8". What the heck's going on?
I'm an inside linebacker, about that size.
I'm a fullback, and I'm gonna block for you. I'm gonna get you 2 yards and a first down, baby.
Exactly.
Or you can put me at the nose guard, and I'll bite their ankles, on defense. I'm like a little pit bull. Oh, that's so cool. All right. Well, hey, tell me a little bit on the layout of your practice. How many ops you got working? Tell me a little bit about your staff. You got a few hygienists. Tell me what you got going there.
Right now, we're at about 1.5 hygienists. Okay. And I work out of 3 ops. They've got 2 ops. We have 2 front desk. I've got 2, a little over 2 assistants right now. We're kind of getting a little bit busy to just go with 2 back there. So we've got 1 coming part-time. Okay. So getting busier and busier, which is sweet to see.
Oh, yeah.
So that's pretty much it. We've got a little suite in the or condo, I guess you could call it, in a professional plaza. We got some doctors, medical doctors, in the front. We've got 1, 2, 3, 4, 5, 6 dentists in the building. So it's
how does that work?
It's a nice spot.
How does that work with competition for you? Are y'all fighting over people? They all just got their own gig, their own marketing strategies. Tell me about that. Tell me how you're driving patients to your practice too, to set yourself apart from those other 6 dentists.
Well, we the big thing that we do is we get together. We used to we do some arm wrestling for it, but I broke everybody's arm.
Yeah,
so now they've given up. So but no,
you're like that dude in Harry Potter, man. I've ever heard. I forgot his name.
Hagrid.
Yeah, Hagrid. In a good way, I'm saying it. Hagrid, get him.
No, we have a company that does a pay-per-click campaign for us.
Okay.
They've also got some stuff on Facebook, Instagram, Pinterest. There's people, I saw your stuff on Pinterest.
Oh,
so I didn't even know I was on Pinterest.
What's
really?
Pinterest? Is that like Instagram?
Yeah.
Is that a picture thing, or you pin it?
Yeah. What is a Pinterest? Yeah.
I have no idea.
Or Instagram. Oh, I saw that thing on Instagram. It's like, what's Instagram? Yeah. So they take care of a lot of marketing. We do a lot of in-office stuff, encouraging patients to refer, and they refer. So we've got a nice line of people coming through the door every month. So
beautiful.
New people.
Did you use any kind of like practice management to get that kind of help, or what did you do to get your procedures and structure in place?
We've been with a couple recently. Productive Dentist Academy is a really good one. The things that they teach you there are fantastic. And we're also working with Team Training Institute, which is Wendy Briggs. Okay. And she does a great job too with all of the stuff is in videos online. And so you can send people, there, hey, we need to work on this. Let's get this done. And yeah, so we'll have
to put those guys up on the podcast, just some info. So some of the dentists, if they want to look into it, we'll get some of the stuff posted for you for sure. What about?
Yeah, Wendy would be great to be on there.
Yeah, that would be great. So tell me a little bit about. I know you do like 100+ hours a year in CE, and what are you doing? Like I know. You probably did it certain ways years past. What are you doing nowadays? I mean, are you going to the conventions? Are you going off site? Are you doing it online? Tell some of our guys on what you're doing for your CE and what you like, what you don't like, what you think works and what you think doesn't work.
Yeah. Early on, I would do a lot of clinical stuff. It was about 17, 18 years ago. I did a residency with Nobel Biocare for implants.
Beautiful.
I've done a number of orthodontic courses.
Did you come down here to Yorba Linda to their headquarters here?
Yep. Yeah. I spent lots of time there. That's for sure.
Oh, they got a great facility. We go there and do lunch and learns, and we have the AACD study group's got a thing in there sometimes for the local study group. But man, that president dude, he's a hard dude right there. But he means business. he's a go-getter, man. That guy. But I don't remember his name. But no, Noble Biocare is the bomb. We're big time with them. We do a lot of work with their products and dentists across the U.S., but that's awesome. So what else? I know you do a lot on Dental Town, and then you also have is it Millennium or that you're the laser? Yep. You did a little with that. Tell me a little bit about that too.
Actually, I did a little with that, and it turned into a lot. I started out doing lasers. I got a water lays, and then I got some diodes and started, doing some treatment with all of those, and realized that there was something in perio that could be done. And Millennium had come along with this procedure, and at the time it was still kind of out on the edge, and it was like, well, should I give it a try? So I talked to a few people that were doing it, and on Dental Town, you get all that support there, and they were doing it, and they were saying it rocked. And I had to get in there and get it because it was lasers and I was lasers. So got in there and it was the real deal. It was fantastic. And I actually started teaching for them. It would have been 10, 11 years ago now.
No kidding.
I go down to teach pretty regularly. And it's a fantastic service for the patients. You can save implants, you can save teeth. I get people in all the time. Oh yeah, they told me, I had to have this tooth out and get an implant. And I take a look at it. It's like, well, we'll see what the surgery does. You've got gum disease everywhere else. We'll get that cleared up. We'll see if we can save that tooth. And about 90% of the time, we can save that tooth.
No kidding.
People are, just excited about, keeping what they've got. And if, every once in a while we'll lose a tooth, hey, we can put an implant in there, but we don't have to put in, 5 implants. We've only got 1 instead of, all the other ones.
Absolutely.
And they're healthy. They no longer have a gum infection, that their immune system is fighting all the time. So it's a fantastic service for the patients, and it's a great revenue producer. So I sit there and think about vacation and outer space and things like that.
And going to Disneyland and Club 33 that you love so much.
Exactly. Yeah.
Oh, man.
But once you learn the procedure, there's really very little to it as far as thinking about it. When you're doing a crown prep, it's like, I got to reduce a little more here. I got to do this here. I got to put in retention grooves because it's not tall enough and all that kind of stuff. With this, you go around each tooth with the laser. You make sure you've got the goop out.
Yep.
You go in again. You clean everything up. I mean, it's really, really simple. There's very little mind demand on your capacity with like implants. It's like, okay, we got to line it up here. We got to line it up there. It's got to fit in here. We got to get this angulation. We can't go too far buccal because the bone's missing there. So we got to go a little lingual and we got to cheat there.
Yep.
This has nothing. You learn the technique and boom, you're done with it.
So is it basically like going around the circumferential of the gingival aspect, just kind of cleaning that, troughing it around, and basically that will re-stimulate and regrow back at that area with all the goop? Or is it something like that in a basic way? Just kind of stimulates the tissue after you clean it up around it, and maybe it kind of grows, and tightens back up? Or I have no idea. I'm just a lowly dental technician. I make teeth.
Well, that's part of it.
Yeah.
The big thing that we do is we get out the epithelium that has grown down in that pocket. As soon as we get rid of the epithelium.
What's epithelium?
Epithelium, it's the stuff that's on the outside that is kind of protecting the surface. And when you get an infection, it grows down on the inside of the pocket.
Okay.
And kind of, it won't really attach to the tooth very well. So it's kind of the helper that helped out, but now it needs to go away. Okay. And so that's what the laser does. It removes that epithelium. And so the lining of the pocket is now no longer stuff that won't attach to the tooth. It will actually attach and have a periodontal ligament.
Is that what forms?
Then you just need to.
Is that form an abscess or no? An abscess something different?
Abscess is just kind of a short-term infection, but it can turn into a long-term kind of thing if it doesn't heal up quick enough and heal up the right way. So people get these infections, they go on for years and years, and the pocketing gets in 7, 8, 9, 10, 12. I've had a pocket I probably estimated at about 25 millimeters.
Dang.
And
was that on a canine?
Healed up.
Oh, exactly. Man.
It's like, we had a couple of assistants that climbed in there just to check it out, but it was that big. Yeah.
I had a friend, I don't know if it was a real deal or not, but he passed away my age, and he had an abscess tooth that was really, really bad, and they said he died from that. I mean, just the poison inside of it. He didn't go to the dentist, and he just kind of just let it, fester and on. And supposedly, I guess there's some big time bad stuff in those things, and it can kill you, I guess, huh?
Yeah, definitely. When you get essentially your bloodstream becomes toxic, and it goes into your heart. You get an infection in there, and you get all kinds of things happening, and it'll kill you. It's one of those things where it's serious.
God rest his soul, Mike Woods, man. That's a trip, and it happened a few years back, and it's just, gosh, I just, I get a little ache or anything. I'm at the dentist. What is it? Well, Sean, you need a root canal again. Like, what? Oh, man.
Another one.
I got like 8 of them. All my molars are like root canaled. It's terrible. Yeah. We didn't have dentistry when we were young. My mom raised 5 kids, 4 boys and a girl. And it's like, well, you go to the dentist, we're going to pull it for $10 or whatever, because you ain't doing nothing else. So I got a couple implants on both quads, and because they had to pull 30, they had to pull 19. And it's like, what? I was like in 8th grade, and just, it's just, I don't know. But,
popping them out.
Yeah, pop them on out. So, dude, you're doing a ton of implants and stuff like that. And way back in the day, work with Noble Body Care. Are you syncing your implants? Because we're doing a ton together. And tell me a little bit about your implant journey, what you like to do, what products you like. Tell me a little bit about implants, if you could.
Yeah, I mean, I've been with probably 4 manufacturers, through the years, and I keep coming back to Nobel. It's a really high quality implant. It's a good design biologically, and it's the one that works. I went with an inexpensive one that was, you get 3 of these for the price of one of those. Yeah. So this is no big deal. And
10 times a headache.
It's
a nightmare.
Like, I really don't need to lose any more heart lining. I I want my stomach to be normal. I don't want to, have the stress. So I've always come back to Nobel. And like I said, I did a mini residency with them, and it was fantastic. It got you in the door. I was placing implants, I think, by the second meeting that we had. And it has worked out fantastic. I mean, I've done some more CE since then, but I'm kind of at the point where you can't really teach an old dog too many new tricks.
Yep, absolutely.
I can modify the old ones, but I really don't want to learn sinus grafting and all that other kind of stuff.
Why even mess with that?
We got surgeons for that.
Exactly. Sinuses, that's some scary stuff, dude. It's like, don't even go near that, man. It's just like, why would you send it over to that old surgeon?
Yeah, that booger up there that you just sucked in there, it just went by. I saw it, It's like, I don't need that.
I'm telling you.
Yeah, it's been a great service for the patients. They don't have to go somewhere else to get it done. I've got to the point where I can place, I think it was last week, I had 3 implants in a half an hour.
No kidding.
The production off that's like $6,000 in a half an hour. I could go down to the beach for the rest of the day.
Heck yeah, you can. No, that's sweet.
So
you're working smarter, not harder, and it's just
exactly.
It's just really neat. How are we doing? How are we doing restoring them for you? We hitting it out of the park, or we get some double?
Pretty much. No, every once in a while we'll get a ground rule double, but most of the time you're slamming it out. It's something where we're 20 minutes for an implant crown to cement it, is a pretty quick thing. You torque it in. We've got the implant supported ones where we're just putting the filling in the occlusal surface, or you've got the custom abutments on the anterior, and they're fitting, they're looking good. So keep it up.
Absolutely. What kind of ceramic are we doing on top? What kind of products are you using there?
Mostly every once in a while we'll do some PFM stuff, especially in the posterior where we're just going direct on the implant. But in the anterior, we go from anywhere from zirconia to a gold hue
for
the aesthetics. And then, a lot of times Emacs in the very front, or we're going with the zirconia, for the bicuspids.
Okay.
So, yeah.
Like our Bruxer aesthetic or Bruxers. Yeah. Back to the education real quick. I just want to, some of the better CEs out there, what do you recommend for some of our newer dentists starting off and stuff? I didn't quite get what you said there. You might want to cut that, Dave, right here. But no, what do you suggest for some of the, on the CE online or any courses? Give me some tips out there for some of our people.
Yeah, the thing that I went through with Nobel Biocare was a mini residency. I think it was 20 days or something like that, where we went down every month for like 2 or 3 days. And that was fantastic. I don't know if they're offering that anymore.
I'm sure they do. I think they do. Yeah. And it's, I mean, their whole thing, and it looks like it's just like they got the beautifulest stage and the full operatories. And it's like a collegiate setting where you got all the, like a little stadium viewing and, it's so first class. So for sure with implants, I mean, Nobel Biocare is just a freaking home run to go see them. And it's beautiful right down here. And the people can actually come by the lab too and stuff. And that would be sweet. What about on other, like any practice management courses or any other type CE with, Crown Preps or Crowns Made Easy? Anything else out there that you can recommend?
It's been a long time since I've done any CE with Crown Preps and stuff like that. I know that the AACD, the stuff that they do, whether you market to that and go after that niche, it's one of those things where the stuff that they teach you is really, really high quality dentistry. And if you can duplicate that in your practice and just do it that way, that's fantastic. If you want to go with the all aesthetic spa type practice, that's great. But the education that you get with them is really definitely first rate, because they're on top of that, making things look good, making things last a long time. So that's a good source. Trying to think of other
have you done
CE.
Have you done anything with Spear or Coys or anything like that ever? Or?
I have. Yeah, I actually was in a Spear group here for probably about 3 years.
Oh,
and
sweet.
They do a really, really good job. Some of their hands-on stuff is good, but their occlusion stuff is like the bomb. That's like everything is if you can get in with Spear and take some of those courses, those are fantastic.
Absolutely. No, that's words of wisdom right there, I think. And for sure. So last question, any advice at all to these younger dentists starting off, do's and don'ts, whatever advice you got, let me hear it.
Get out there, get some clinical stuff under your belt. You need to realize that dental school turned you into a really, really safe, below beginner. You really are just safe enough to be out there in the public. So clinically, you need to grow a lot. Yes. And there's things with CEREC and things like that. There's implants, there's ortho, there's perio surgeries. You got your pinhole technique and all that kind of stuff. Mm-hmm. Go out and find something that, cranks your tractor. If it's endo, do the courses that, who's the big guy down here in Santa Barbara?
Buchanan or no?
Yeah, Buchanan. Yeah. And guys like that, go on Dental Town, see what people are excited about. Do that, but keep a good budget on it. Don't go out, go crazy and spend tons of money and then not really have the skills to show for it. But find out the values that are out there from other people that have gone through it. Learn how to do surgeries. That's one of the things that if you get in there and you get your get your gloves nice and bloody, doing surgeries. It's like, you can stay away from it. But I found that the more I get into surgeries and doing things like that, the more I feel comfortable with everything else. It's kind of one of those things where, no big deal. Let's go ahead and take those wisdom teeth out. If you don't want to go to the oral surgeon, these are ones that I can take out. We'll do that for you.
No kidding.
And, get comfortable with your profession. And then make sure that you get something. If you don't have a mentor, either clinically or business wise, go out and find one and kind of ease your way into that. Find one that you can work with and go from there.
Absolutely. Thank you for your time, man. It was a great podcast.
Absolutely.
I really thank you. And thanks for all the work. And man, if I can do anything.
Definitely. Thanks for making those margins nice and smooth.
Yeah. Hey, it's an honor, man. It's just, thank you so much. We can't thank you enough. And Dr. Colleran, I'm going to talk to you real soon.
All right. Well, next time I'm in town, I might stop on in there and see you.
Yeah, come on by. And
all right.
When's your Disneyland trip again? Isn't it usually summertime you going to that, or what's the deal there?
No, actually, we do the fall and the winter and then the early spring. So right now we take the time off when it's really hot down there, and you can't get any relief from the heat when you're standing in line for Big Thunder Mountain, so we go where it's nice and cool.
Hey, the best one's Radiator Springs, man, getting on those cars.
Absolutely.
I love that.
Yep.
We go there and we go on that one ride only, and we'll leave 2 hours later. It'll be the only ride we do, but I love it, man.
Yeah.
All right. Well, hey, thank you so much, Dr. Colleran. We really appreciate it, and we'll talk to you real soon.
All right. You take care. We'll see you.
All right. Bye-bye.
Bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.